So to determine if your patient is going to be appropriate for lumbar manipulation, you can look at a cluster of symptoms that you may find in the subjective, such as symptoms being around for less than 16 days, no radiating symptoms below the knee, a fear avoidance belief questionnaire score less than 19, finding at least one hypomobile segment with PA pressure, and having internal rotation of one hip at least greater than 35 degrees. So that's important because if a patient had less than 35 degrees of internal rotation on both sides, you should be probably looking at their hips rather than their low back as the possible origin of their pain. So once you've determined that to be appropriate for lumbar manipulation, you'll just have them roll onto their side facing you. Don't get too specific here. You can spend a lot of time kind of bending their leg around trying to flex to the correct segment, but when it's all said and done, their foot's just going to end up behind their knee anyways, so just bring it up and put it behind their knee. Grab their bottom elbow and have them grab onto your shoulder blade. You're going to reach over and feel where their shoulder blade is, and you want to just rotate them enough to clear that shoulder. You can either have them hold onto their elbows or put one hand behind their head. I prefer to have them hold their elbows. You want to have your chest at a 45-degree angle, kind of up towards their head, and you want to have your hips and your ASIS level with their ASIS. You're going to kind of get over the top of them with your forearm, kind of right behind their greater trochanter. You're going to roll them towards you while you simultaneously kind of bring yourself over the top of them, and you're going to apply a downward pressure. The thrust that you're going to create is not through your arms, it's directly into the table. It's a body drop. So you get over the top of them, you get a little extra pressure and take up that rotation. You can kind of feel that rotation with your top hand, and you thrust.